Hi, I'm Rick Barron, and welcome to another installment of RAF 5 on the history of neurology. And today I want to talk about German and Austrian neurology in the 1800s and into the 1900s, and talk about famous and also infamous neurologists and neuroscientists and psychiatrists from that period, which really is a cautionary tale that tells us some things can happen in Germany and can happen anywhere. So one of the first famous German neurologists, and really the father of German neurology, and in many ways Western neurology, is Moritz Romberg. Romberg was born in Germany, and he spent his medical school era and his whole career in Berlin. He did some postgraduate work in Vienna, interestingly, and what he is really known for is two main things, I think. One is the writing of what I consider the first true neurology textbook, a manual of nervous disease. It was published in Germany in 3 volumes in the 1840s, and then was published in English in 1853 in London. It's a wonderful book. It's still relevant to this day. And in that book, he described the other thing that he's famous for, and that's what we call the Romberg sign. So in his textbook, he described that in tabes dorsalis patients, one of the signs was loss of balance, with patients standing with their eyes closed. And we now know that as Romberg sign due to sensory tract pathology in the spinal cord or in the peripheral nerves. Here is another picture of Dr. Romberg and the face sheet from his famous book, the first English translation. Here is one of my facsimile copies of his book, in which all 3 volumes have been bound into one. And you can still get both original copies and facsimile copies. Here's some of the points in his table of contents. This is about sensibility, and in one of these chapters he talks about what we now call Romberg sign. So he was really the father of German and perhaps Western neurology, had a huge impact. Other really famous German and Austrian neurologists in this period we can mention. One is Friedreich, who spent his career in Heidelberg, Germany. Erb was his mentor. He was Erb's mentor, and we'll get to Erb in just a minute. He described ataxia and muscular dystrophies, which we now know as Friedreich's ataxia. Dr. Meinert, who was born in Dresden, he was born in Germany, but he really spent his whole career in Austria at the University of Vienna. He was a chair of psychiatry and a neuropathologist, and he really believed mental illness was a cortical dysfunction and the organic basis of mental illness. And he founded the field of cerebral cortex cytoarchitectonics and organization. He had many famous students during his career, probably most famous Sigmund Freud, who we'll get to in a minute, also Wernicke, Korsakov from Russia, Henri Forel, also from Russia, and Julius Wagner-Jauregg, which we will get to in a minute, as one of the infamous neurologists. Other famous neurologists who had major contributions to neurology in this time period were, of course, Karl Wernicke, who was born in Poland, but trained and spent his whole career in Berlin. And he, of course, described the sensory form of aphasia from a temporal lobe lesion. Edward Hitzig was really prominent in the field of cortical localization, and he is the first that stimulated the motor cortex and was able to show movement on the opposite side of the body. And then, of course, Alois Alzheimer, born in Munich, who devoted his career to the study of dementia, and he wrote his monograph on this in 1907, and he described presenile dementia, plaques, and tangles. Very, very important neuroscientist from the early German era. And you can't really have a discussion about neurology and psychiatry in Germany and Vienna and Austria without talking about Sigmund Freud, who actually was born in Czechoslovakia, but his family migrated to Vienna early in life, and he was educated in Vienna. He in his early career was really a neuroscientist, and he did research on the nervous system of the eel. He developed some new staining techniques that he published in the journal Brain, and then he briefly spent some time with Charcot, which had a lasting impression on him on his externship, if you will, in Paris. He founded psychoanalysis and the concept of unconscious ego and superego, and of course his most famous book is Interpretation of Dreams in 1900. But he was a neurologist, and he wrote important books before he wrote on psychoanalysis and dreams, on aphasia and on infantile cerebral palsy. So here's a picture of his book on interpretation of dreams, but also the German edition of aphasia from 1891 and his important work on infantile cerebral palsy. Other well-known neurologists from this phase, which had major contributions, would be Carl Westphal, who had his whole career in the Charité Hospital in Berlin. He was the first professor of neurology at Prussian University. He noted absent deep tendon reflexes at the knees and tabes dorsalis. Dr. Hermann Oppenheim also deserves mention, who also spent his career in Berlin. He was Westphal's student, actually, and he wrote on traumatic neuroses, dystonia, tabes, and amyotonia congenita, and he wrote a wonderful 2-volume textbook on nervous disease, which is still available for purchase in 1911. One of the other really famous neurologists who had a major contribution from Germany is Dr. Erb, who practiced in Heidelberg his whole career, and he wrote widely on a number of topics, including myasthenia gravis, muscular dystrophy, spasticity, spastic paralysis from spinal cord lesions, and probably most famously upper brachial plexus palsy. Dr. Jolly, who doesn't sound like he has a German last name, but he definitely was German, born in Heidelberg and practiced in Berlin, and he's followed Westphal as the head of neurology at the Berlin Charité Hospital. He wrote widely on myasthenia gravis, and he invented repetitive stimulation of nerves in myasthenia gravis. And here's actually a picture of his some of his original nerve stimulations showing a decremental response from 1895, and some people still call this the Jolly test, even though it's not very jolly. Now let's talk about a few infamous neurologists, which people may not be aware of. Emil Kraepelin, who was born in Germany and spent his whole career in various German cities, was really the founder of modern scientific psychiatry. And he classified psychiatric diseases in a way that's still used today in the DSM system. But he also was a proponent of eugenics and racial hygiene. He said it was important for Germany to preserve and enhance the race. And this is one of his quotes, a well-known example of the Jews with their strong disposition toward nervous and mental disorders teaches us that extraordinary advanced domestication may eventually imprint clean marks on the race. Another neuroscientist I put in this category is Julius Wagner Jürig, who was a psychiatrist trained under Meinert in Austria, and he eventually took his position as professor of psychiatry and nervous disease in Vienna. His claim to fame was using fever as a treatment for dementia paralytica of syphilis, and by raising the temperature, he thought that, and he had evidence to show that this improved their dementia. And so this was called pyrotherapy, and he was able to induce the elevated fever by producing a malaria infection in the patients. Amazingly, he won a Nobel Prize for this in 1927. And he wrote a book, Prevention and Treatment of Progressive Paralysis by Malaria Inoculation, in 1931. But with the rise of the Nazis in the 30s, he had major Nazi affiliations, and he was a known anti-Semite, and he also advanced racial hygiene, eugenics, and was an advocate of sterilization for the mentally ill and criminals. Hans Berger was a psychiatrist from Germany who worked under Otto Binswanger, actually in Jena, the chair of psychiatry and neurology, and then he succeeded him in 1919. And Hans Berger invented the EEG, a major development, and he was the first to recognize the alpha rhythm in the brain. But he was a Nazi and a member of the SS, and this was not known. When I first did neurology training in the 80s and we learned about Hans Berger and the EEG, this information wasn't known, and it actually just became available in 2005. Two other neuroscientists whose Nazi allegiances just became available in the last 15 to 20 years were Julius Halliburton and Hugo Spatz, who described the disease we now know as Halliburton-Spatz disease, but now we refer to it as pantothenate kinase-associated neurodegeneration, and we officially changed that name from Halliburton-Spatz disease in the last 20 years because both have now been shown to be known Nazi party members. And to end this discussion, I'll mention Carl Jung. Definitely very, very famous, almost as famous as Freud, but also possibly infamous. So he was born in Switzerland, but he had very close relations with Germany and Austria and the physicians there throughout his career. And of course, he was a disciple of Freud. But then he broke away and he founded analytic psychology and the concept of archetypal images. After he was famous in the 1930s, he actually helped restructure the German Medical Society for Psychotherapy, which was led by Matthias Goring, who was the brother of Hermann Goring. And this society excluded Jews and in their journal promoted Mein Kampf. And in one of the early editions of that journal, there are two quotes from Dr. Jung that are listed here. The Jew who is something of a nomad has never yet created a cultural form of his own, and as far as we can see, never will. And he also wrote the Aryan unconscious has a greater potential than the Jewish unconscious. So as you can see from this brief overview of famous neurologists, psychiatrists, and neuroscientists from Germany and Austria, they had an amazing influence in getting the field of neurology and psychiatry started in the 1800s with major contributions to the field. But then in the 1930s, really a number of these famous neuroscientists were influenced by Nazism and in fact became Nazis, which shows that this can happen anywhere, even in a very advanced cultural society. I opened this talk saying it can happen here, which is a paraphrase of Sinclair Lewis's famous novel of the 1930s, which is titled, It Can't Happen Here. Thank you for listening to this RAF5 section on famous and infamous German and Austrian neuroscientists.